Dr. Artie Majan, CEO and founder at the Deuk Spine Institute. I'm here with a patient who traveled from Canada for his lower back. He's been living in back pain for many years. I'll let him tell you a little bit more about that. But he had the Deuk laser disc repair done yesterday, less than 24 hours ago, and now he's here, sitting here. Are you having the pain that you came here with?
No, I'm not. I'm actually sitting, and that was hard for me before. So that's like my gauge that it's actually done something that's worked. Like
Yes.
I couldn't sit for years. I stood, right? I stood eating, I stood doing my work, a stand-up desk. I'm actually sitting. So like, to me, this is amazing.
And you had the Deuk laser disc repair to fix 2 of your discs in your lower back. We tested them in the surgery and they were indeed causing a lot of pain for you. You could see in the video that we used a laser to go in and clean out the annular tears in the back of the disc that were causing your pain. So that pain that you had before surgery, is it still there or is it gone?
Yeah, it's gone. It's like I'm in disbelief that it's not there.
We didn't give you pain pills to make it go away, did we?
No. I tried to avoid them as much as possible because I wanted for the pain to be real, so I could figure out like how much in pain I was. Apart from just taking one after the operation, right? Because it kind of felt like it picked something heavy up. So I'm referencing to prior pain that I've had. I didn't really take anything other than that pill.
So you took one muscle relaxer last night and that's
Correct.
it?
Yeah.
Yeah, and that only lasts for about 6 to 8 hours. So right now you have no medication in your system. This is natural. This is how you're going to feel.
I'm like in disbelief because being in chronic pain, at some points I thought like I was like not there, like, and it was almost crazy, right? But you know, you did what you did, and I just can't thank you enough. It's amazing.
You're welcome. And tell me about, you're from Canada. I know
Yeah.
it's hard to get good medical care,
Yeah.
even in the United States, but I heard Canada is difficult. What were you offered for your back?
Well, it was kind of a step-by-step process because they want to do like a process of elimination. You know, initially it was some pills, some drugs, a lot of physio. That's what my doctor said, physio. And I did that and it still wouldn't go away. Then it was, okay, consultation with a spine clinic and kind of going down that road. It took a long time for all that to happen.
Meanwhile, you're suffering in pain.
Correct, yeah. I remember specifically when I was driving to my physio appointment, that was like a 45-minute drive and I couldn't sit. I was like almost crying, driving to it to get a bit of relief and then driving 45 minutes back. And I was like, this is crazy, this is nuts. There's gotta be a better way. And then that's when I got online. I did a lot of research. I did like 2.5 years of research of anything and everything, right? To learn about the condition, to learn about, you know, what I had. Once I got a little more educated on it, I'm like, okay, I'll be honest, in the beginning, I was scared about spine surgery. I'm like, no one's touching my spine. Absolutely not. Like, and so that's why I was hitting the physio hard, right? But as soon as I started to understand, and then I found Dr. Deuk online, it caught my interest. I'm like, this can't be real, right? I thought it was just the kind of a marketing gimmick. I saw more, and then he had videos online, and I was going through all those, and I had a bunch of questions. The more videos I watched, the more questions he answered. And then I even, asked a couple questions myself. I got in there. I'm not a social media guy. I was just trying to educate myself more and more. Finally, I'm like, I pulled the trigger. I'm like, okay, I got to do this because this. I looked at other surgeons, other surgeries. I've looked at, you can name it, and I've looked it up. This one I found to be the most effective.
And you've got Henry to thank for the videos.
Yeah.
Henry, you're touching lives with your work.
Here to help,
Yeah.
Absolutely.
We have a whole team, 75 people working here, and all of it's geared towards this one moment where people come and get relief.
I can't believe this operation is amazing that you have here. Thankful to everyone, your staff and your people, because it has made the whole experience.
When do you head back to Canada?
Saturday, so a couple days from now.
Well, is there anything else you want to say wrapping up the conversation?
No, I'd like to, praise you because it's just amazing. And I'd like just people to know that you're the man.
Well, thank you. I can't take all the credit, obviously. I'll take it on behalf of Deuk Spine Institute, sure, which really deserves the credit. All the people here that make it happen, they make my job easy. Well, congratulations.
Thank you very much.
All right, enjoy life.
Thanks.
All right. And hopefully we don't see you anymore.
Hopefully.